Ma'am, should I begin?
Yes, sure.
A very good evening, everyone. I, Dr. Misbah Kadri, and Dr. Akshita Gupta will be the moderators of today's session. We welcome you all to the Cynodent International and Indian Society of Dentistry webinar series 2023. Theme of the series is Unlocking the Trends in Dentistry. For today's session, I would like to invite Dr. Pramila Verma, ma'am. She is professor at Department of Conservative Dentistry and Endodontics, Faculty of Dental Sciences, KGMU, Lucknow. Topic for the webinar is Endodontic Emergencies and Endodontist Dilemma. I would like to invite ma'am to start the session.
Thank you, Ms. Ba. First of all, I would like to thanks Cynodent team for inviting me as a guest speaker for this webinar. And so coming to my topic, endodontic emergencies and endodontist dilemma. I myself, Dr. Pramila Verma from the Department of Conservative Dentistry and Endodontics, Faculty of Dental Science, King George's Medical University, Lucknow. First of all, know that what is an emergency? Emergency is an unforeseen combination of circumstances or the result of state that calls for immediate action. And in endodontics, there are several conditions which may occur during the treatment procedure or after the treatment, which may require an immediate action. And the patient may approach to you in an advertent time, which cannot be avoided, and you have to be ready for treating the patient. So it's all about the pain and swelling. The pain is the condition which brings the patient to the doctor. This is the Davidson definition, that pain is a condition which brings the patient to a doctor. So pain and swelling will, with the combined effect, has a very tricky situation for the clinician. So first, let us enumerate some of the complications which may occur during local anesthesia administration. And as we has been taught that there are complication resulting to local anesthesia is an anaphylactic reaction, which is a life-threatening situation. And this situation has been taught us from in our undergraduate and the postgraduate teaching. But there are several conditions which are rare, but it may occur due to the administration of local anesthesia. So a few of the complications other than anaphylaxis reaction, which may lead to an endodontic emergency, I would like to enumerate here. And the first is some of the complication while administering is the anesthetic solution is ocular complication may occur during the treatment. It may be the ocular complication may be a diplopia, strabismus, ptosis, loss of accommodation, ophthalmoplegia, or amaurosis. So, ocular hematoma. First of all, to discuss one of the cases which reported in our department, that is ocular hematoma, which has occurred due to the injection of while treating the patient in the first premolar, the infraorbital nerve block was given, and the patient developed a hematoma in the orbit. So as you can see the diagrammatic representation, the infraorbital nerve supplies the upper part of the lip, ala of the nose, and the lower part of the orbit. So this is a situation that a female 65-year female patient was reported to our department with a chief complaint of redness in the right eye, and along with the swelling and discoloration on the right side of the face and lower eyelid. There was a pain in the maxillary right posterior region. On inquiring the dental history of the patient said that the patient went for an endodontic treatment in a private clinic a day before she has come to the clinic, our clinic. There was a redness in her eyes and the skin was discolored in the lower part of the orbit. So patient in this condition, the cold pack first all the patient was reassured that there's nothing, that she will be all right. That this is the major step which was taken, and the patient, she was advised a cold pack of 20 minutes 4 to 8 times a day, and anti-inflammatory along with proteolytic enzymes was also advised, along with ophthalmic opinion was taken from an ophthalmologist, and patient advised that she should not rub her eyes, and eye drop containing nefazoline and phenylephrine was also advised. So after 7 days of treatment, the patient was completely asymptomatic. Another complication which may occur is the complication after inferior alveolar nerve block, that is amaurosis. First of all, we should know what is amaurosis is. Amaurosis fugax is a temporary loss of vision in one or both eyes due to the lack of blood flow to the retina. So I will be discussing a case where the patient got a loss of vision, a temporary loss of vision due to the administration of inferior alveolar nerve block. So this is a 37-year male patient reported. A patient was undergoing treatment of the right lower posterior region for 15 days. So of grossly decayed lower right first molar. So as we can, our local anesthesia was administered in the inferior alveolar nerve block was given. As you all can see in the diagrammatic representations that in this, the inferior alveolar nerve block was given. The inferior, this has penetrated the inferior alveolar artery, and the anesthetic solution has reached the orbit region and had caused a temporary loss of the vision. So when the patient was given the patient immediately, that there was a blurring in his eyes, in the right side of the eye, and after there was a complete loss of vision after 25 to 30 seconds, and the patient became very much panicked that he has lost his vision. So this was a very panic situation for the endodontist also. So in this condition, the patient was reassured that nothing is going to happen, and he will be completely all right. So the patient was reassured and kept it in a supine position, and all his vital signs were observed. The ocular motility tests were performed. That patient was asked to move his eyeball from in left or right direction, upward and lower movement was advised. So that there was a ocular motility was observed. And after 15 minutes, all the symptoms disappeared. And there was a complete vision resolved after 30 minutes. So this was a temporary loss of vision because of the administration of the local anesthesia. When we administered a local anesthesia, in the intravenous vascular administration of the local anesthetic agent may get penetrated into the maxillary artery. As we all know that inferior alveolar artery lies in proximity to the inferior alveolar nerve and is run posterior to it. There may be an accidental injection into the inferior alveolar artery, and under pressure, the forces which forces the anesthetic solution into the maxillary artery and middle meningeal artery where the retrograde flow. So this temporary amaurosis result from the local anesthetic being carried into the central artery of the retina, where the anastomosis of the ophthalmic and the middle meningeal artery. So where the recurrent meningeal branch of the lacrimal artery. So sometimes we are always, while administering the local anesthesia, we have been always advised that we should always aspirate the needle while administering the local anesthetic into while giving a block. So sometimes this aspiration creates a negative pressure in the proximity, which is adjacent to the vessels, which creates a negative pressure, and this thus pulling the inferior alveolar artery close to the inferior alveolar nerve. And when we forces the anesthetic agent with the help of the plunger, they may get it create a negative pressure. It may pull the inferior alveolar artery near to the inferior alveolar nerve, and the tip of the needle may penetrate the inferior alveolar artery. And this anesthetic agent may be deposited in that, and which may flow to the ocular region where the ophthalmic artery. So there may be a blockage. So there may be a blockage of the flow of blood to the retina, which may cause the temporary loss of vision. So it is always advisable that we should aspirate the needle in all the three planes, not in only one plane, that all the three plane has to, it should be aspirated in all direction. So before deposition of the anesthetic solution to the particular site. And a 25 to 27 gauge needle with not more than 16 ml should be used to minimize the hematoma. So we must be very much cautious while administering the anesthetic agent. So what are the precautions which one needs to be take to prevent the ophthalmic complication? That we should avoid the injection into the injecting the injection into the vascular system. Always aspirate prior and in all three planes, and it should be administered very slowly to the site. The knowledge of the anatomical structure is very must, and that so that regarding to the particular nerve block, and follow the accepted injection techniques and procedure should be followed to avoid any complication and leading which may lead to a medical emergency. The another accident or complication arises due to the use of the sodium hypochlorite. This sodium hypochlorite, as we all know, that is a gold standard in the irrigant solution. So, but because of its properties, but sometimes what happens that due to the forceful administration of this sodium hypochlorite into the root canal, it may extrude beyond the apical region, and this patient may feel excruciating pain, and there may be the initial reaction when the sodium hypochlorite may go beyond the apical region. The patient, the initial reaction of the patient is a severe pain, and it may be followed by edema and bruising over the injured site, which may be immediate, or it may be a delayed, which may appear 24 hours after the treatment. So this is a very panic situation for the patient, but it should be noted that the patient should be reassured and calm that she will be or he will be all right. And for the image management of this sodium hypochlorite accident, if sometimes this occurs, that the immediate irrigation of canal with normal saline should be done in several times to dilute the sodium hypochlorite solution present in the canal. And if there is a bleeding from the canal, it should be continued to flush the irritant out. So, and patient should be on the affected side, the patient should be avoid ice pack compression for 24 hours, the 15 minutes interval to minimize the swelling. And patient should be recommended warm, moist compress after 24 hours with an interval of 15 minutes. Acetaminophen based narcotic should be prescribed for 7 days, and prophylactic antibiotic coverage for 10 days to prevent the secondary infection. Amoxicillin 250 mg TDS or metronidazole 200 mg TDS in penicillin allergic patient should be given. Steroid therapy can also be used for 2 days to control the inflammatory reaction, and the patient should be reassured that and provide with both verbal and written home care instruction, and patient should be monitored periodically. So how to prevent the sodium hypochlorite accident? This is also that prevention is better than cure. So we should take the measure that this type of accident should not be occur. So what are the measures which has to be taken? That a proper good straight line action of the cavity design with adequate coronal preparation should be done, so that a proper direct access into the canal can be done. A pre-operative periapical radiograph to see the apical region or the length of the canal should be, which can be visible from the radiograph. And specialized needles like the layer lock needles or the blunt and the side vented needle should be used, so that by force the the sodium hypochlorite agent cannot go beyond the apical region. And proper working length should be done, and carefully adjust the rubber stopper so that you do not perforate the apical closure. Prevent this, and try to that you should not wedge the needle tip of the needle into the canal, and it should be placed loosely into the canal. It should not, we should place that needle into the canal, but it should not close approximate to the apical region. So it should be away, and avoid using the pressure applied to extrude the sodium hypochlorite from the syringe should be very light pressure should be given, so that it with the pressure it cannot go outside the canal. And the needle should be constantly moved in and out of the irrigating needle into the canal. So now the other complication or emergencies which may arise due to our intracanal medicament. These canal medicament is a boom to the endodontic treatment. But sometimes the inadvertent use of this medicament may also cause a complication or emergencies arising in our clinic. The pharmacresol is a most used endodontics, which due to its antibacterial property as a root canal disinfectant. So this pharmacresol, this consists of the formaldehyde and cresol. This formaldehyde is an effective alkylating agent, and cresol is a protein coagulation phenolic compound. So there is a case which occur in our clinic. I would like to share with you. So there was a use of the pharmacresol, and this has been published also. So this is a case where a 37-year female patient reported to our clinic with necrosis of the oral mucosa and swelling on the affected side of the face. On taking the dental history, she said that she was in our undergraduate clinic, she was treated for the treatment of the maxillary left first premolar by an undergraduate student, where he has started the root canal. And after the she has given pharmacresol, a cotton soaked with pharmacresol was put into the chamber of the first premolar. And after 24 hours, she has seen a sloughing of the oral mucosa and swelling on the face. The patient was very much apprehensive, but again, the reassurance was given, and patient was advised a betadine gargles, a mixture of steroid-based cream and hexigel for local application, along with analgesic and antihistaminics with multivitamins. And you can see after 7 days of treatment, there was a complete resolution of the symptoms. There was the oral mucosa has come to the normal form, and there was also subside of the swelling of the patient. Sometimes our own instrument may also create an emergency in our clinic, and there may be an accidental swallowing of the endodontic instrument. So I am sharing you one case reported by our colleague. That there was an accidental swallowing of the endodontic instrument. In a 20-year-old systematically healthy patient, female patient, was undergoing a root canal treatment of the maxillary right central incisor, and the patient was being prepared to receive a fiber post, and a post drill was used to prepare the post space. But when suddenly the drill got unattached from the latch of the micromotor handpiece, and it fell on the patient's floor of the mouth. and it was swallowed by the patient. And this was a very panic situation if this drill has may get aspirated from the it may go into the trachea, but it was fortunately it was in the esophagus region, and the patient was allowed that the patient was immediately seated in an upright position and was asked to cough vigorously so that it may get either it should get out of the esophagus or it may get inside. So a high roughage diet and bananas were advised to ease the passage of an object in her digestive tract, so that this high roughage diet and bananas they promote the easy passage into the stomach. And the image patient was also advised the PA view of the abdomen to see the location where it has, and we can see that this file has gone into the lower part of the intestine, where it is can be seen in the this radiograph, the PO view of the abdomen. And you can say in the due course of time, it has passed through the alimentary canal, and it has passed out from the feces. So patient should be was very much assured that, and patient this reported that he was the X-ray shows that there was a complete removal from the alimentary canal. Sometimes our dental instrument also, which we are using as an may also cause an emergency in the office, and our three-way syringe has also created a panic in our office, and this was also reported in the Journal of Endodontology. So the etiology or air emphysema is that the patient when a compressed air is being forced into the tissue spaces, it may cause air emphysema. In endodontics, there are two procedures which may cause air emphysema is the during canal preparation. When we try to dry the canal with the help of a three-way syringe, it may cause the air being forced outside the apical region, or during the apical surgery, the air from the high-speed drill can lead to an air emphysema. So this is a case where the patient showed swelling which developed during the RCT, and this was reported a day after the initiation of the root canal by a private practitioner to our hospital, and there was a swelling on the face, and there was also swelling of the infraorbital region also. There was the intraoral examination, they revealed a swelling in the buccal vestibule extending from 2.2 to 2.4, and the swelling was prominent in the periorbital region and the conjunctiva. So it is advisable that avoid the increase in the intraoral pressure, such as blowing of the nose vigorously or playing musical instrument which could introduce more air. So to conclude with my lecture, the initial management should follow the principle of the 3Ds, that is diagnosis, definitive dental treatment, and drugs in that sequence. And patient in such type of situation where the emergency arises, there is a psychological management of the patient is the most important factor, because if the patient may panic and he may lead into more complication. So it is always advised that you should reassure the patient. In anxiety reduction is the important factor in reducing the intraoperative and the post-operative pain, and try to control the situation. Again, win the confidence of the patient. You should always be by the side of your patient, so that there should be he should that the doctor is side me and nothing is going to happen. And provide attention and sympathy, and treat the patient with an important individual. So thus, while doing endodontic treatment, we must that all our drugs which are miracle for the endodontic treatment sometimes may cause complication and emergencies arising in our dental clinic, and we must take care and use it properly. Thank you.
Thank you so much, ma'am, for the informative session. Ma'am, now I would like to proceed with the question answer round. Should I
Okay.
begin, ma'am?
Yes.
Ma'am, how to make anesthesia effective in a hot tooth?
In a hot tooth means the patient is difficult to manage that patient. So you should hold the tooth with your finger and just patient that may be not effective or local anesthesia may not be effective in the hot tooth. So you while doing an SS opening, you can hold the tooth with your fingers so that and do the SS opening.
Okay, ma'am. Thank you so much, ma'am, for the wonderful session, and thank you,
Thank
ma'am, for the answer. Now, I would like to thank the founder and CEO of Cynodent, Dr. Anmol Bagaria, ma'am, and co-director of Cynodent, Dr. Ashish Chandra, sir, and also thanks to my co-moderator, Dr. Akshita Gupta. Thanks to all the participants who joined us today. I kindly request all the viewers to like and subscribe our YouTube channel for getting daily updates and webinars. Thank you so much, ma'am, and thanks everyone for
Thank you.
joining us.
Thank you, Cynodent team.